Welcome to the Harvard Health Minute. I'm Dr. Terry Schrader. When I prescribe a medication, like other doctors, I'm hopeful the patient will take it. Unfortunately, we now know that between 50 and 75% of all prescribed pills are not taken as directed or not taken at all. So why aren't patients taking their medication? To help answer that is Dr. Rob Shmerling, Associate Professor of Medicine at Harvard Medical School. Welcome, Rob.
Thank you.
So is it cost? Is it side effects? Tell us all the reasons people, including us, don't take our medication as prescribed.
I think there are a lot of reasons, and cost is a major one. Many patients have a form of sticker shock when they get to the pharmacy to fill their prescriptions, and taking less of the medication or even not filling it at all is a way to save money. Side effects are a big problem as well. Patients may avoid a medication or take less of it than prescribed to reduce the risk of side effects.
And how about effectiveness? Is it ever that the patient just says, or again, we say, I don't really think we need this medicine, I'm just not going to take it?
Absolutely. I think there is some skepticism that a medication is helpful. If a patient is taking it for a condition that doesn't cause symptoms, they may not feel different while taking the medicine, and they may notice when they skip it, they don't feel any differently. So I think that a skepticism about whether or not the medication is absolutely essential is part of the problem.
And there's also, obviously, physiologic detriments to not taking your medication. Talk to us about that. What about not taking your medication or taking it every other day, for instance?
Sure. So assuming a medication is prescribed for a good reason, the condition the medication is prescribed for may go undertreated or untreated if the patient doesn't fill the prescription or doesn't take it as directed. So that can cause pain, that could lead to complications of the condition, or even premature death.
And what should a patient do when you're thinking of not taking that medication? Either the doctor's writing it out in front of you, but you're worried about the cost or side effects, or you've filled it and you've got it home and you realize you're just not going to take it. What should you do?
So whether it's at the first visit when it's first prescribed or later on, if the issue becomes one of not taking the medication as recommended, it's important to talk to your doctor about the reasons, to bring up whether it's cost, whether it's side effects, or whether you're just not sure you should be taking it. It's an important discussion to have with your doctor.
Now, what about forgetfulness? My guess is that's in there, whether we don't usually take a pill and now all of a sudden we have to take a pill a couple times a day, or it's adding to the 5 pills we already take every day. Are there low-tech and high-tech ways to prevent this forgetfulness?
Yes. Well, I think forgetfulness is probably one of the major contributors to not taking medications as prescribed. I certainly have a hard time remembering to take medications when they're prescribed to me. And there are some simple ways to address that. Keeping a journal with a list of your medicines and checking off when you've taken it. A calendar can be filled out where each medication is listed. Pill boxes can be used to set out the medications for the week or for a month. And you know you've taken the medicine if the pill box for that day is empty. And there are higher tech options as well. With the advent of cell phones being so common, you can set your alarm to remind you to take a medication each day or multiple times each day, if that's what you need. Text messages can be used as well, whether they're sent from a doctor's office or from someone who helps you keep track of your medications. So these are all options to consider.
Thank you, Dr. Shmerling. All important information to help remind us how and when to take our medication.
Thank you.